So I'm going to say a bit about Bowen treatment for sciatica and how does this work. The treatment would be focused on relaxing the large muscles in the area around the pelvic girdle, such as hamstrings, quadriceps, glutes, to name a few. But like always, you are unique, and your Bowen treatment would be tailor-made for you based on your contributing factors. So a little bit about Bowen treatment. It works on muscles, ligaments, tendons, and the connective tissue of the body by gentle cross moves. These slow cross fiber or Bowen moves work to bring about hydration to areas of tension, allowing the muscles and connective tissue to move more freely and thereby reducing pain. The process of a Bowen treatment itself is very relaxing and works to get the nervous system to relax, and by doing so can bring about relaxation to other body systems that can sometimes be overlooked in terms of pain, either chronic or acute. Systems positively influenced by a Bowen treatment session other than the muscular system include digestive, lymphatic, respiratory, and all connective tissue, or what is known as the fascial network. Each Bowen move is done at the level of the superficial fascia and affects the relationship between the fascia and the nerve, muscle, or tendon being mobilized. Fascia plays a major role in muscle coordination, postural alignment, and overall structural and functional integrity. All of these are negatively affected when the fascia stiffens, contracts, torques, or dehydrates. So following a Bowen session, adhesions can be loosened, scar tissue softened, and posture and mobility improved. When you come for a treatment, you might want your shoulder pain sorted out. That will happen. However, Bowen treats the whole body as well as where the pain is presenting, as our bodies are so clever in protecting us and automatically develops compensatory patterns throughout the body to help us cope with what's going on. So, why is the actual move in Bowen so effective? Why are there distinct steps involved in performing a Bowen move? Why is it so important to make the Bowen move slow, emphasizing each step? It's because proprioceptors and mechanoreceptors are part of the nervous system. They are sensory nerve receptors situated in the fascia, muscles, tendons, joints, and the lining of the bone. They get information to the central nervous system concerning the movement and positions of the limbs and trunk and head and neck. There are various types of peripheral nerve fibers found within the superficial layer of the fascial system, muscles, joints, and tendons. They each speak a unique language, responding to different sensory stimulation based on their orientation and stimulation. Some send information about muscle tone and joint positioning to the central nervous system. Some determine tension patterns held within the system. Others are protective, determining end of range motion of joints. The brain then integrates this internal sensory information and makes large and small adjustments to movement, posture, and balance. So to wrap up, the Bowen treatment is gentle, deeply relaxing, non-invasive physical therapy which frees the body up in order to attain its natural healing. The treatment consists of carefully orchestrated movements along the spine and at specific points throughout the body. These movements consist of subtle rolling of muscle, nerve, and tendon and connective tissue. It's the deeply relaxed state that Bowen treatment induces that facilitates the impact of specific soft tissue moves that seems to act upon the body's autonomic nervous system to enable it to achieve homeostasis at a cellular level and to regain its natural balance. Some conditions that have found to respond well to Bowen treatment are musculoskeletal pain, arthritic pain, acute and chronic back pain, carpal tunnel syndrome, fibromyalgia, sinusitis, foot and ankle problems, frozen shoulder and other shoulder pain, hamstring issues, headaches, inflexibility, knee and hip restrictions, plantar fasciitis, postural and balance problems, tennis elbow, TMJ syndrome, asthma, and lots more. The pivotal point in a Bowen treatment is when the body shifts from a state of emergency or fight and flight to a place of relaxation where it can rest, reset, and heal. Blood flow increases, allowing for oxygen delivery, cellular activity is improved, and lymph flow is stimulated, aiding in detoxification. And that's the end of the story of how Bowen works for sciatica.